My name is Carol, and I had surgery on August 30th last year. So I'm at 11 months, and in one more month, I'll be at my year mark. So I had an unstable AC separation after I was T-boned by a school bus. Unfortunately, I wasn't diagnosed properly for 5 months, and I wasn't able to have surgery until the 6 month mark. So I work as an ICU nurse, and I had initially had a grade 2 AC separation, but unfortunately the ER didn't do a tube view, so they missed it. And then the doctor that I went to after that did an MRI, and he said I had a compression fracture and bleeding in my clavicle, but missed that I had the AC separation. So I was not given a sling or told to restrict my movement, and I lift heavy patients for a living. So unfortunately, it turned into an unstable grade 3 where I had horizontal instability. At 5 months, I was in excruciating pain. I had aching, stabbing, sharp shooting pain all the way down my arm, into my neck, and into my back. When I first saw the so I went to a nurse practitioner after that, didn't diagnose the problem. So finally, by the fourth physician, I finally was given a diagnosis. Um, he, when I was first told I had an AC separation, he didn't know that it was a grade 3. Initially, he thought it was a grade 2 because mine didn't stick up high. And he's like, "There's no way you can have pain going all the way down your arm." Well, unfortunately, this was much worse, but because I have hypermobility and a connective tissue problem, it hid the fact that it was as severe as it was. Um, so I am very thankful for my surgery. I would not, I don't regret having the surgery. I'm thankful to get back to the life that I love. Um, the recovery portion of it, giving my body time to heal, was the hardest part. I am a very active person, and so 3 months, like 6 weeks, you wear a sling and you can't do anything. And then after 3 weeks, or 6 weeks, then you have another 6 weeks of only active and passive range of motion. Well, once my surgeon said that I could remove the sling, I wanted to reach my head because my husband and my daughter were doing my hair, and I, I couldn't get into physical therapy for 2 weeks because of the volume of patients they were seeing. So I went on YouTube and looked up, what was recommended for this type of surgery. And within 2 days, I got full range of motion. I would not recommend that. That was a bad idea. But at the time, I was, I had warmed up. I was doing things slowly. I didn't realize that, I had ripped all my scar tissue and got full range of motion in 2 days. Um, but after 2 days of doing my own physical therapy and pushing too far, I ended up getting full range of motion. So then when I saw my physical therapist for the first time, she had me do a whole bunch of different moves, and she looked at me and she's like, "How do you have full range of motion? You just had surgery." I'm like, "Well, my husband and my daughter did my hair for 6 weeks, and I was done with that. I wanted to be able to, the only goal I had doing my own physical therapy, waiting to see them, was being able to do my own hair. Because, I actually had to go to the neighbors one day because my hair was driving me nuts and nobody was home. So, and then after that 6 weeks, which would be at the 3 month mark, that's when I was allowed to strength train. And I only had 4 weeks of strength training, and I was able to hold my body up in a plank and do shoulder taps. And I was able to get on all the exercise equipment. The only thing that took a lot longer was being able to do pull-ups and stuff like that. That took a while. At 11 months since my surgery is when I've tried to do pull-ups, and I'm in pain for a couple of days after that. So that's the only thing that's taken me a little longer. And now I can do pull-ups without any pain. I have This is my scar goes from here to here. I have no pain at all. Initially, after the surgery, it was numb for a few months, but now I have full sensation back in my shoulder and everything. So, and I have full range of motion. Um, yeah, so it's just the recovery time it takes forever. That was the most frustrating thing, and that's the only thing I would say something you need to keep in mind about, because for me, I felt like, well, if I could rip the scar tissue in 2 days, then we can go straight for the strengthening, and you can't do that. Like, thankfully, I'm a stubborn person, and thankfully my surgeon was like, nope. And even though I was mad and complained to the physical therapist, please let me do more, they were like, nope, you have to do things on the table that your surgeon has established is a safe progression. So, but this was the easiest surgery I've ever had. The recovery was super easy. It's just frustrating. Wearing a sling for 6 weeks and only use one arm was frustrating. And then the slow physical therapy progression and being out of work for 3 months. I mean, I went back to work, but I was like doing things like data entry and checkoffs and flu shots. And, I missed being at the bedside. I missed the fun of it. So that was the only thing that was super hard. But I have no pain at all from my surgery or anything. And like, I am so thankful because towards the end, before I had surgery, because my shoulder wasn't attached anymore, my arm, the muscles were moving abnormally and they were becoming weaker and weaker. And I remember there was a code that I was in, and I was trying to bag the patient, but to lift the chin up and, get a proper seal, I was at the point that I didn't even have the strength to properly do that and create a good seal to properly ventilate this patient. So I had to get somebody else at the head of the bed to start bagging the patient. And it was just like, I can't even do my job. Like, I love being a nurse, and I really enjoy what I do. And I was scared after the surgery, thinking, am I ever going to get back to everything that I love to do? But the only things that take time, and, I don't know if I'll ever be at 100%, are like where you pull up your body and, doing pull-ups. I go on a machine where I'm pulling up half of my weight or fourth of my weight or whatever. But like actually pulling up your whole weight, I haven't done that yet. I just don't want to mess up the surgery because it has given me so much relief. Like, not being in pain, oh man. 6 months of that pain, it was excruciating. Like, I had more pain going into pre-op and getting prepped for surgery than I had after my surgery, where they cut off my clavicle, cut off the end of it and drilled holes in it and put the cadaver tendon in there, and drill like screws that are that like break down over time. So there's no other than the tendon, there's nothing in my body that has stayed. It's all been dissolvable, which is so cool. It's amazing. So I don't have any metal, rods or screws or anything, but there are risks. There's a risk that the bone in the front, the coracoid can break. So definitely am more cautious with exercises and how I move my patients and making sure that I have proper technique and really taking my time with working out, and doing the proper technique and not going jerking and doing it too fast, because my shoulder is never going to be as strong as it is on this side because of this injury. I mean, a scar tissue is formed there and stuff to kind of keep that tendon in place. But I don't take lightly the gift that I've been given with this cadaver tendon. And it's really cool because I actually have been writing the wife of my donor back and forth. And that's been a phenomenal experience because I'm always on the other side, you know, getting the patient ready for organ donation and stuff like that. So to be actually a recipient is a profound experience that I cannot even begin to describe. So that's basically it. I full 100% would recommend doing this surgery if you have an unstable separation. If you don't, financially, being out of work for, depending on what you do for your job, being out of work for so long, and the physical therapy and allowing your body time to recover is frustrating. And it's, you know, it's expensive, but completely worth it. It's given me my quality of life back. And to me, quality of life is everything. And being able to do water sports and, you know, climb and to hike and to like, because you don't, when you have an injury like this, as my arm was getting weaker and weaker, like I couldn't raise it past here. I couldn't, like, I was scared when I was getting a patient out of bed because this was so unstable that it affected everything. It affected, you know, when I was cleaning or, you know, doing laundry, lifting the basket and stuff like that. But it's great. I have full range of motion. I can do everything I want to do, you know, up into the point of doing a pull-up completely without like lifting my body completely like 100%. I haven't gotten there yet. I'm slowly getting there, but I'm just happy to be strength training because the entire time from my injury to my surgery to being allowed to strength train, like that was 9 months because I would go to the gym and I couldn't do anything with this left arm. I couldn't like lift weights. I couldn't because I could feel the bones hitting each other. And that was the most awful feeling, is to like pull up a patient or make dinner and get something out of the oven and feel the bones gliding in, you know, colliding into each other. I'm so thankful I don't have that anymore. But I wish you guys the best if you have a grade 3 AC separation, and just know that things will get better. Whatever path you go on, if you don't have an unstable separation, there is some great information out there on strengthening your muscles to help strengthen it. Lack of having those ligaments there. But unstable, hands down, I wouldn't wait. Whatever the financial cost is not worth the disability that you're going to create for the future. So that's my 2 cents. And I wish you guys the best. Bye.